Well, joining me now is the Health Minister, Chris Hipkins. Kia ora, Minister. Given what you just heard then and this extension to Auckland's lockdown, how many people do you think are still on your team of 5 million?
Oh, look, I don't think anybody's happy about it, but I think New Zealanders do understand that we need to make sure we're giving ourselves the very best possible chance of not having to go back down into lockdown in the future. If you look at other places where they thought they were clear, they moved out of lockdown too soon, they had to go back into lockdown again. Nobody wants to see that in New Zealand. So we want to make sure that we're doing it well, we're doing it properly, and we're getting our freedom back as quickly as we can.
Would you accept that you've already got some compliance issues in the Auckland region?
No, not necessarily. Look, I do understand.
Did you not see pictures from the weekend and kids on playgrounds, people out playing sport, people picnicking at the beach in the sun? Those are compliance issues, aren't they?
Yeah, well, and my message to all of those people is, nobody wants this lockdown to continue any longer than it needs to. So if everyone sticks with the rules, if everybody does the right thing, then, of course, we can stop transmission, we can get out of this, and we can get back to normal.
Why is the South Island included in this?
Because of movement. New Zealand, as a country, we have relatively free movement across the country. There is a lot of movement between Auckland and the South Island, particularly areas like Queenstown, and we don't want to have to stop that movement.
Why not just say they can't come into Auckland and then they can be at level 1?
Well, because that's very, very difficult to enforce.
Did you consider it?
Well, because yes, we did. But if you look, we would then be in a position where we'd potentially have to put the rest of the country back up to level 2 when Auckland comes down to level 2, because we're not going to have the checkpoints in place once we get to level 2.
In Cabinet, what specific information did you consider about the economic costs of this? What forecasts were in front of you?
Oh, look, we consider a wide range of information, but we've always been really clear that the best economic response is a good health response. So,
I do understand that, Minister, and you've said that before, but what I'm trying to ascertain is specifically, because it's a big deal for business, what specific economic cost-benefit information was in front of you today when you made this decision?
We had the same economic analysis that we've had in all of the decisions that we've made, which is it looks at and I don't have the figures in front of me, but it looks at the overall cost of the lockdown and what the costs of continuing the lockdown are, both in terms of costs for businesses, in terms of potential impact on jobs, and we've also
nothing updated since the initial Treasury forecast. Then is that what you're saying?
No, I'm not saying that. I'm saying that the same type of information, and I don't have those figures in front of me. If you wanted to, if you wanted to ask specifics about that, the Minister of Finance is the right person to ask that rather than the Minister of Health. But the Cabinet was certainly provided with that information.
But you were in that meeting, so do you not remember the numbers? Because, that's really important to business, isn't it? And I know this is a health response first, but as you would have heard, businesses are really hurting, so they want to know what you considered. Do you know the number?
Yes, and of course, what we considered was the potential consequence of another lockdown because we didn't contain this current outbreak before we came out of lockdown, and that would cost businesses a lot more than a few extra days at this point.
In terms of the Auckland cluster, have we peaked in terms of cases, in terms of the modelling?
There's a variety of different models. Obviously, we had quite a low number of additional cases over the weekend and then a bigger number of additional cases today. The good news is all those additional cases today were known contacts, so there were people who were already isolating because they were known contacts. But we haven't yet reached, a point where we're absolutely confident that it's, completely contained. And so we are being cautious here. We're not taking any more time than we feel that we need to take, though, in order to make sure that we've got this as well contained as possible before we move down the alert levels. So
where are the vulnerabilities at the moment? You've got this case that's turned up at North Shore Hospital. Is that one of them?
Yeah, so we've got a number of cases that we're still doing investigatory work around, and without wanting to get into all of the personal details of the people concerned, obviously those investigations do get quite deep, and we're working very fast, obviously, to try and get as much information as possible so we can run down exactly how the virus has been spreading and who else may have been infected.
So how many cases are you unsure of the spread with? How many are still under investigation?
There's still 3 cases under investigation to establish exactly how they might have transmitted. We've also got the issue of just making sure that we've contained the spread from some of those. You'll be aware that we're looking at some bus trips where there's a vulnerability there around bus trips. It does appear that the virus has been spread on at least one bus trip from one person to another, and at least one of those people has travelled on other bus journeys, and so we're in the process of contacting all of the people who would have come into contact with that person through riding on a bus.
Okay, I want to talk about the buses a bit more in a second, but just clarify, those 3 cases that you say are under investigation still, are you including the maintenance person from Ridges in that, the North Shore case, and one other bus case? Is that the 3?
Yes, that's correct. There are 2 other cases where we've got more information, so we've been able to link them through genome sequencing, but we're still doing a bit more work to just make sure we've got the transmission point as clearly identified as possible. So about 5 cases in total are still in the investigation process, but 3 of those are, I guess, there's more work to do on than the other 2.
And you still don't know the origins of the Americole cluster, the Auckland cluster. You still don't know where that came from. So how can people have confidence that you've got this under control?
Well, the extensive amount of testing, we may never quite know where the origins of that were. Even after all of the testing and all of the work we've been doing, we still haven't been able to establish a clear link to the border or to managed isolation or quarantine or to somebody who's travelled. And that is a huge puzzle. It's one of the things that we would very much like to know, but we have to accept that we may never know the answer to that.
Doesn't that leave us exposed, though? Because that's a weakness that you can't identify, so you can't plug it.
No, well, look, there will always be vulnerabilities in any system. You can never be 100% sure of anything. We were not, we could never give 100% guarantees the last time we were in this position.
Understand that, but do you accept by not being able to identify the start point for this, we are exposed? The weakness still exists. You don't know what it is.
Oh, we're exposed anyway, and that's the point that we've made all along. This is a virus, so there's no 100% guarantees here. But what we can say is we've tested everybody around everybody who has tested positive. So their workmates, the people that they've been in contact with, their housemates, the rest of their family, and we've been, very clear publicly about what that is showing up. That would suggest that we're containing it within those people, but it hasn't given us a really clear steer of how it came in the first place. It seems to have appeared out of nowhere in the cold store. That seems to still be the earliest place there, and how it got there in the first place is a real mystery.
There's a lot I want to get through, so if we can crack through some of it. So the bus trips, right? So you've got one original retail worker and one other person that you think has caught COVID on the bus?
Yes, that's correct.
Okay, so did they sit next to each other? How far apart were they?
Well, exactly. I mean, people give a description of where they sat on the bus. So the description they've given is that they both sat towards the back of the bus. There's a lot of work going on at the moment.
Do you know how many seats apart they were? How many rows apart they were? No,
we don't. We know that they both sat near the back of the bus.
So obviously, I mean, the details are that it was a 2.5-hour bus trip and the bus just travelled a few kilometres, and this is because of the bad traffic on the day, correct?
That's my understanding. Well, one of the reasons that we're able to piece this together is that both of the people described being caught in traffic, sitting at the back of a bus, and it would appear that they were on the same bus.
Are you 100% sure that they were on the same bus?
As of this morning, that hasn't been 100% confirmed yet, and I haven't had the latest update, but it certainly looks very, very likely, given the route that they travelled, given the time they travelled, and given the way that the description they had of the bus trip, it would suggest that they were both on the same bus.
But do both of them have registered hop cards, which means that you can confirm that categorically?
My understanding is that in the case of one of them, they hadn't, as of this morning, been able to access the hop card data for one of the people because the people hadn't actually produced their hop card. They were in quarantine and they didn't have their hop card with them, so work was going on to make sure that they could get hold of the hop card.
Okay, so you're asking for people to wear face coverings from next week if they go on public transport. Are you going to fine people if they don't wear them?
Look, there are fines available under the COVID legislation. I haven't yet finalise the order that will make that compulsory, and that'll all be clear once we've got. I'll be doing that in the next day or two, going through all of the technical legalities of that. We've made the decision to make it compulsory. Now we've got to go through the process of making that a reality.
I know you've got to go, but very quickly, have you given any thought to adjusting the September school holidays, given students have missed so much school? They'll go back for a couple of weeks and then they'll be gone again on holidays.
No, we are looking at what additional support we can provide to those senior secondary school students, particularly the ones studying towards NCEA, to make sure that they can finish their year, they can finish their assessments. Adjusting the school holidays doesn't necessarily provide a lot of help and potentially adds a lot of pressure to them. So we're looking at ways that we can provide them with more support.
Appreciate your time this evening. That is the Health Minister, Chris Hipkins, who's also the Education Minister.